Hello, everyone, and namaste. Well, we are going to be talking about a different topic today, Ayurvedic psychology, what exactly it means. So I have in our studio a very special guest, Ayurvedic doctor. She is Dr. Shivani Sood. She is an Ayurvedic doctor of international repute who has collaborated all over the world, with different Ayurvedic projects. Welcome, Dr. Shivani.
Thank you very much, Amita. I'm so happy to be here.
Great. So I know you have a presentation that you wanted to share with the viewers, and we want to understand when you say Ayurvedic psychology for disease management, right? So what exactly do you mean? But before that, we would love to hear your personal story as to, I know you were misdiagnosed at one time and what prompted you to enter Ayurveda.
Right. Right. I guess the stories make a deep impact on us, our life, because, in Ayurveda, it's all about finding your purpose in your life. And since I was a very young baby, I suffered from a lot of health challenges. I had a very sick childhood to the point like the doctors did not know what was going on with me. I went from clinic to clinic and was nobody knew what was happening with me, and that was one part of my life, and my mother healed me with a lot of soups and herbs and so on. But long story short, I forgot all about it. I went into teenage, a regular Indian teenage, and ended up in Ayurveda. And entering Ayurveda was a turning point for me. I'm still a very modern person, and I teach Ayurveda to the modern society in the West. But entering Ayurveda, I realized that this is one of the missing part of the puzzle, and it needs people, who will really help understand this traditional science in a modern way to the society. So it became my mission to communicate Ayurveda in the most easiest form that everybody is not feeling forced and everybody can be like, I get it. So I love this and this became my passion. So that's how I came into Ayurveda and turned from just like an ignorant person to today being the biggest fan of it. I'm 18 years in practice. I've done 36 international projects, and I'm a verified NAMA professional for US, and I'm the honorary member of the Polish Society, written books. So that is like a lot of work I did, not because I had to, because of my love for Ayurvedic work and for teaching Ayurveda. And
Sure.
please say.
You have a presentation you wanted to share with us as well. Do you want to
Yes.
share that? Okay.
Yes, let's do that. Okay. Can you see my screen?
Yes, yes.
Right. So
all right. So we are going to be talking about how Ayurvedic psychology, specifically psychology, helps in disease management, right?
right. Right. So let's come to the topic of the Ayurvedic psychology. So first thing is that Ayurveda is based on two things. First of all, it is based on really keeping the healthy people healthy, right? Like to protect the health of the healthy people. And the second thing, what we really have in Ayurveda is to question while we treat a person why he has become sick, right? Because when we know and when we are aware of the fact of, what makes us sick, we take the responsibility of not being in the same situation again. So, what is Ayurvedic psychology? So, Ayurvedic psychology, it addresses the mental imbalances and how to treat them with holistic method so that the person returns to the state of inborn mental equilibrium. When we see children, we can see them, right? Like they're so happy. We cannot really see the children's stress, and as we grow up, we really, start to separate our thoughts from our body. And in Ayurvedic psychology, everything is just interconnected. And to live a life truly in harmony with our nature, we must also learn how to live in harmony with ourselves and with the society, So this is a very important part of Ayurvedic psychology, is to like how is it different from the Western psychology. And my special interest in Ayurvedic psychology came in after I finished Ayurvedic medicine, and I was misdiagnosed with rheumatoid arthritis, luckily, because I still remember the day when I stepped on the floor and I just couldn't walk, and I was an Ayurvedic doctor, so I knew the best of the medicine, and my husband just took over my work, and left me in house, and I remember putting ginger and turmeric and all the paste on my joints. Nothing worked. And that really made me question, a lot of things in my life, who I was, my relationship with myself, my relationship with the world, my purpose. And obviously, it was misdiagnosis. So the disease went away. And I could just imagine the agony of somebody, who had a chronic diagnosis and had to live with it lifelong. So when I came back to Ayurveda, I was like, yes, the mind is the answer. And that time, my determination, to come back to life and really, you know, this feeling like I'll walk on my feet again, I'll be all right, really helped me. So when I came back in 2003 after my sickness, I was a person who really wanted to know more and more why the people are sick. And today it's my passion and story. So that pain really changed me, and it brought me back to the connection of the pain of being sick in childhood, like the flashback of all the things which had happened in my life. So, how is the Ayurvedic psychology different from the regular psychology? Because, there's a regular psychology out there. So, how would we really differentiate? So, the first differentiation, what we have here is that Ayurveda considers the whole body as one, and it has an integrative approach in treating psychological ailments. That means that we read the signs of the mind on the body. Let me give you a very simple example. When we have stress, then our jaws are really tight. So we clench our teeth and we have teeth marks on our tongue. So when you look at the tongue, you can see signs of stress in the mind. So we have body evidence. And I mean, like the most common evidence I see in myself when I'm stressed is tense shoulder muscles. I feel like everything is tense, my back is not straight, And, we see more connections which the modern science sees today, because the modern science says today that the gut and the brain is connected, and Ayurveda said everything is connected from ears. So that's the differentiation, that the Ayurvedic psychology basically has a connection with the body and doesn't operate only on a mental level. The second most is like differentiation from the regular psychology is that if a person in regular psychology has anxiety, he has anxiety. He has a protocol for anxiety. In Ayurveda, there can be two different reasons why you have anxiety. For example, I think like being an Indian, we know Indian moms, and they're always making us careful about things. If you go out, this will happen, that will happen. So you become an anxious person as you are a child. And that is the reason you have anxiety. In the second scenario, you can have anxiety because you want to prove yourself to the world, and you take much beyond on your plate rather than what you can handle. So you see, like in Ayurveda, one same disease, anxiety, can have different origination. And by finding out the exact reason, we can help that person in a better way. And that really makes us feel heard and understood. Because whenever we are sick, it's a call for help. So Ayurvedic psychology really gives you this individual identity rather than generalizing diseases. The third thing is that nutrition, which is often forgotten in mind, is a very important form. Like, I mean, we all know this, that, when we have eating disorders, at that point, we are eating with emotions. So that means the emotion and food is connected, like the gut and the brain is connected. So this is a very important part of Ayurvedic psychology, that we offer nutritional advices. We offer advices on the base of changing the rhythm of your day, the lifestyle of your day. A very common example is like how you start your day, makes a big difference in your mind and in your whole day, how it works like, So that is very important part in Ayurveda, that we do nutritional modification of lifestyle so that a person can really have his mind healthy from his daily habits. The fourth thing is like in Ayurveda, we are not really waiting for the disease to manifest, right? Like there's the unique identity of a person, which is called your Prakriti, like your nature. Like in the animal kingdom, we have the dogs and the cats and the lion. Nobody is confused because it's a very clearly marked territory. So in humans also, we have our prakriti, the way we are born as, and this is our fundamental nature. So some people are more anxious, some people are more brave. They take in more challenges, So basically, like prakriti is the way we perceive things in our environment. We can see this, in families, like the same parents are there, yet sisters are so different, right? Like you're very different from your sister, though you had the same parent. So you see, like based on who you are, you might already know what kind of challenges in the mind you might be facing. So if you are a person who is like an air type, which is called an Ayurveda Vata type, so you might already know that you might want to take care of your anxiety levels. Or if you're a fire type, you might want to already keep a check on your ego, because the fire type are like, yes, I am the number one. Nobody else can be better than me. And that's one of the thing where we start to really over push, pressurize ourselves, and we become sick. So we don't wait in Ayurvedic psychology that a disease manifests, and a lot of, because of the basic fundamentals of Ayurveda can be done for a healthy person to live his life in a completely happy way.
So this is a little bit different, right? I mean, we are in Western society generally, we don't really have a personalized system of maintenance of our body in the sense like, yes, we can eat healthy food or we can have different kind of, I mean, that's all of us are trying to do that. But in Ayurveda, the difference what I'm understanding is that it is exactly personalized to my mental, my emotions, my physique or whatever
Right.
my prakriti will be. Right?
Exactly. Yes. And a lot of predictions can be made, and it is very like you feel that it's for you, like I'm talking to you.
Yeah, I also want to bring a very interesting point. I know this is really fascinating, the work that you're doing. So a lot of people right now are using genetic testing, right? To say, oh, genetic testing, if you do the genetic testing, you can personalize your diet accordingly. But the difference, what I personally feel, and I'm not a doctor, is that in the genetic testing, it doesn't measure your mental state, as opposed to in Ayurveda, the mental state is a key component to
Right.
your overall well-being, right? I mean, what are your thoughts on that?
Right. I think Ayurveda is always open to all the new ways of testing and seeing, but it really like is a very non-judgmental science. I would say that it might be good for few people and few aspect, all the aspects of the work which is happening today. But when we come, so Ayurveda doesn't feel challenged with it, So it really means like, what is the purpose of doing that? That is the most important question. Where you need a needle, you need a needle, like, so Ayurveda basically is like this kind of science which is really not feeling challenged by any kind of new testings coming, because this ancient way is just like so synchronized with our own being. And I mean, like, come on, we feel the body, right? Like when we even feel stress, I feel it in my belly, I feel it in my shoulder. And what you feel has the most important thing, is the most important evidence. So I really believe that every new testing has its place. We cannot really be critical about it, because the point is like, who needs it for what? But
Sure.
Ayurvedic knowledge, most of the people just walk away because they're not able to really understand the knowledge, right?
Yes. Yes.
Right. So I'm just going to finish with the difference from the regular psychology. So here, Ayurveda also talks about your immunity and your ability to shine, the enthusiasm you have. Have you observed kids, how enthusiastic they look? Like they just look like they have this energy. And as we grow older, we find this energy declining. So Ayurveda talks about these three components which are part of the mind, which is called Ojas, Tejas, Prana, which is basically your immunity system, the light you have within, and your capacity for oxygenation. I mean, with COVID, we are all talking about our oxygenation capabilities today, but Ayurveda is already talking about your breath is really connected with your energy levels, right? So when we have these three things in order, we can really live our life to the fullest. And the way, like, remember, like when we're really irritated and we come back home and our son does something to irritate us, we're just snapping quickly. But when we have this inner calmness and balance, and the same thing happens, we are very calmer in our responses. So Ayurvedic psychology brings in that calmness in us. The way we respond to our general, to our partners, to our parents, to our children. And that really, makes a big change in the quality of life we are living. Another thing is like consultations are a very important part of Ayurvedic psychology. We have this 90 minutes to make an impact on making a client understand what is his responsibility. And while I was doing a lot of European projects, I naturally tended to attract people who kept coming back to me again and again to ask me for advices. And normally, if a person goes to an Ayurvedic doctor, he doesn't come back. He takes the prescription, he knows his dosha, and like, what am I going to do next? And people kept coming back to me, and I was wondering what is happening here, because I went to Europe, and my major projects were in Northern Europe and Germany. So the appointments were full with the same people. And I'm like, okay, where will the new client come? But that's because consultation and crafting message, they wanted to hear something from me, what they can do in their current life after 6 months, after, to make it a better quality. So how we craft the message in consultation is a very important part. Do I really connect to my client? Do I make him understand what he needs to do? Or do I just judge him and tell him that, well, everything's wrong with you, and that reminds us of force, and human beings don't do good with force when we are forced to do something. So, and the last point is that the integration of yoga, Vedanta concepts and therapies, like we have something to do with our body, that really makes a difference in the Ayurvedic psychology. So summing it up, long story short, these are the three parts. Consultation, which are based on like a psychological consultation, runs a little different from the traditional consultation in Ayurveda. So in this, we recognize your psychological type, how what is your perceptions, who are you, why do you feel this way? And we bring in this concept that nothing is wrong with you, right? Like you're totally fine. You're struggling because you're not identifying yourself. And we like teach the clients how to use their sense organ in the right way. We can see this in a very simple word. It's called pragnya path in Ayurveda. So you see, like when we are really happy and we feel healthy and we love ourselves, we go and open our refrigerator and we see fruits and we see vegetables and we see all the good things which are good for our body because we are balanced. Same thing, we don't feel good. We walk into a coffee shop and we order this big cake and we know we shouldn't be eating that. It's too much. So you see, like sense organ and understanding yourself and bringing in this balance, all of this magic happens in a consultation. And then we have herbs, nutrition, lifestyle. But the deeper aspect of Ayurvedic psychological treatment really depends on the therapies which Ayurveda offers, which is basically marma therapy, which are like 107 points over the body, which help to remove the blockages in the body. And then we have, basic Ayurvedic oils, which are massaged into a person to bring it, the sense of really relaxing the person deeply. And therapies like Shirodhara, Shirobasti. I mean, this goes to the medical aspect, but after counseling, he has a whole lot of system to take care rather than just being given one herb for something. Right? And so we really receive deep health when we have Ayurvedic psychology. Would you like to ask me something?
Sure, sure. So what I was trying to, this is actually very fascinating. So let's say you have a 90-minute consultation and you're going to map someone's mental state in different aspect, right? Or different stages or whatever you want to call it, like the sattva, the rajasic and tamasic, the tamas and rajas and sattva, at least those are the three states that at least we all know. Is that how it works? And then you kind of say, okay, now Amita is like whatever, XYZ, based on that, my psychology, then you say, okay, these are the herbs or the nutritional lifestyle changes that I would have to do based on where my mental state is, right?
The first thing would be to make you calm in your diseases, make you understand what's happening to you. Mm-hmm. Right? When we are in an imbalanced stage, we need to understand what's happening with us. What is really connected? So the first thing in Ayurvedic psychology is to connect all the diseases, like how it is like connected for you, and to tell you your responsibility of why you are feeling this way. Obviously you can use the terminology, but what makes the impact on the patient is what is his responsibility to heal it, right? Like you can use the word sattva, rajas, tamas, but more than that, I mean, like, this is a rajasic world. Like
Yeah.
the world is stimulated, and in the West everything is too fast, there's lack of time. So in Ayurvedic psychology, the first thing what you will really learn is to find the balance inside this imbalance, right? Like not to really create an ideal scenario, but to teach you how to manage within these diseases. What are the calming nutritional things you can do? What are the calming daily activities? What is that what you can change in your perception, so that you see that in a different way, right? So a
That,
90 minutes consultation will help you recognize who you are, why you're struggling, and the future. What's the next step? Here we go in a planned, organized way ahead and pull you out of your diseases.
sure, that makes sense. That makes sense.
Right. Okay. So here's the thing, when it comes to disease management and Ayurvedic psychology, what I discovered is there's no extent to which we need personal help. We really need personal help, especially when we are stuck in chronic situations and we are stuck in repeated habitual pattern. And that kind of help, at least like for a doctor, it's very difficult to give because doctors are limited to prescription, in the medical side of the diseases. So when you are a person who is in holistic field and knows Ayurvedic consultancy, you will know how to really get that person out of stress without being a doctor. And that's what Ayurvedic consultant is. He's a person who can really recognize, on making you recognize your positive and negative patterns, what are creating diseases, and impacting your health. And when it comes to disease management, the way we perceive disease in Ayurveda, diseases are a way to really understand and take responsibility for the deeper changes we need to make within ourselves, right? Like I told you, like my own story about how I had rheumatoid arthritis, and how I really changed. Like after that, my health is my number one priority, right? Like it really changed. I never want to be on that situation again, running here and there, and medicines are just a temporary solution. Now, this is a very complicated topic, how disease management and Ayurvedic psychology plays an important role. And I have tried to break it down into a very easy format to understand. So, you know that in any sickness, three things play a very vital role. The Western medicine acknowledges it. Number one is stress. Definitely, yeah. Because when our body is under stress, it releases inflammatory cytokinins. And these are, chemical messengers that bring a particular part of our immunity system to high alert. Right now in COVID situation also, we have high cytokinins in the body, and it's been discussed with the stress levels of the people, which has happened with COVID too, So what happens is that if our body reacts to stress, if there's an infection, then when we are chronically stressed, it seems like there's a chronic infection in our body. And our immunity system is basically working wonders, and it saves us from a general infection like, flu and strep infections. But when we have chronic levels of inflammatory response, high level of these cytokinins in the body, it just leads you to all the kind of chronic diseases. For example, depressive disorders, high blood pressure, arteriosclerosis, autoimmunity diseases, like my history about hitting rheumatoid arthritis with emotional things was because of this same research. So also immunity system activation can develop, whether we also develop cancer. So basically in disease management in Ayurveda, when we are really changing our perception about who we are, like our relationship with ourselves and the world impacts our healing ability. And we know these medical wonder stories where a person couldn't walk, but he was so sure he's going to put his foot back on the ground, and he was told he would be paralyzed, and he started moving again, because in the impression of the person, the world is a wonderful place and he wants to get back to life, right? So in every disease, whenever we want to heal, whenever our mind is strong, whenever our mind thinks, okay, I'm going to get well and go back to the life I was dreaming to build, Our bodies naturally are supporting this inner response. And that way, many times when I ask clients also, who have a lot of health, I said, like, what would you do if I take all these health problems away? I think they had no answers for me. They were like, okay, it would be gone, but I never thought it would be gone, you know? So when any disease comes, our relationship with ourselves and how we perceive our life really makes an important thing. And based on this, our daily habits, right, and lifestyle are impacted. Definitely. Every day, our lifestyle is impacted by our mind, how we feel about ourselves, whether we think we are precious or not. So, these three factors collectively play an important role in all the diseases, basically, right? Like using our immunity system, like not really being stressed to improve our relationship with ourself, our body, and wanting to live in this world with this positive vigor, with a very clear sattvic mind. So it's just a state, right? And with when you learn disease management and Ayurvedic psychology, these three things make every disease better. But like there is a lot of things with disease management, but these are the some common examples which I would show, which everybody can understand, which helps in psychology and disease management. Like mostly for irritable bowel syndrome clients, this is a very common gut problem where you can't, again and again go to the washroom and you have anxiety troubles. So when you learn how to calm yourself down, when you learn how to connect with your body, at that time you calm the disease down. It's very clearly evident. There have been researches which have been showed that a calmer person, IBS is reduced. Another thing is the thyroid. And I mean, like hormonal issues and thyroid are one of the highest problems which are happening in the world today. So in Ayurveda, the thyroid is in the area of the throat, and this is the throat chakra. Throat chakra has a lot to do with expressing your truth, accepting who you are, finding your purpose, speaking to people about it, like talking what you feel. And in many civilizations and societies, we have been told not to own our voice and not even to communicate what we feel. And this is like the area of Germany where I was working, there's lots of thyroid patients who really left the thyroid medicine and shifted on natural herbs for support with this work. Like they worked on expressing themselves, of communicating, about speaking, of picking up all these incidents which they had kept inside and told nobody, just with the help of consultations. So you see, like this, there are many things which really impacts disease management. Like when you have a positive self image and when you feel excited about your life, as I said, then you accelerate any kind of chronic healing. You're not just a problem running from doctor to doctor to running from test to test and feeling stressed out about it. And we learn in life always to trust others, but we don't learn how to trust our own self and our bodies. So when we learn to trust our body, when we learn to understand ourselves, tremendous change comes. Even learning how to respond to anger, learning how to express it in alternate ways has impacted the levels of acid in the body. So when you calm down, when you slow down, and we can instantly see that when we are trying to be more faster than our body abilities, we drink and kick ourselves with coffee. And coffee does increase the acid levels, right? So that also shows that food has a mental influence. When we eat a lot of sweet, we want to go to bed because you've eaten too much. So Ayurveda is that part of puzzle which really makes you understand that your body is your responsibility, and outside information might be right or might not be right. But if you are not knowing this information, if you don't know how to tap into the space of knowing about yourself and healing your body, then you are missing in the world, the right to own yourself. So in this way, Ayurvedic psychology is basically the fundamentals of all the healing of all the diseases. And on various stages of life, it can be used also for your personal growth, development, and to speak to yourself in this positive manner that nobody can really pin you down or make you feel less about yourself because you know yourself.
I think it's fascinating. Any questions anyone has, you're welcome to put it in the chat and we can answer the questions. Now, I just want to understand one thing. So the Ayurvedic psychology, it's not like a self-care thing that I can do. I need to talk to a specialist like yourself, Ayurveda doctor who's trained in the psychology. Is that how it works? Or is
No.
there any self-care techniques?
There is self-care techniques. It just depends on how, obviously, when you're in complicated situations, you would need somebody to talk to and help you understand what's going on. But on a daily habits, on a term of understanding yourself, there's definitely education which can be really useful for you to know more about yourself and to take actions on an everyday basis. And like the more and more the doctors and the consultants will train the people to care about themselves, the society will become a much better place.
Sure, absolutely. So, can you share some of the self care techniques that at least people can start going in the right direction? And then, of course, when they need the full fledged, then they seek someone like yourself who will navigate them with the proper consultation, right?
Right. Right. So when it comes to understanding self-care with Ayurvedic psychology, the first thing what we really need to take care is our daily rhythm,
Mm-hmm.
right? Like this is the foremost thing. And we can see this that most of the people are more hyperactive in the night, right? Like in the morning, they're sleeping and their day starts at 12. And by this, I mean a lot of kids also. And Ayurveda, if you want to have your mind in order, the morning is very important, right? Like, so waking up in the morning and following the rhythm of the day, exercise has to be done in the first part of the day and not in the end of the day when you're completely tired, pushing yourself. So, first thing when you wake up in the morning is really shifting your mind towards being grateful towards who you are,
Mm-hmm.
right? So even your negative aspects are actually talking to you, right? Like they're trying to protect you. So whatever information or whatever stage you are, first thing what we see in Ayurveda is really developing gratitude. So when you wake up in the morning, the first thing what you should really do is think about 5 things you want to be thankful for in this day and see how it really makes an impact on changing your day. So in Ayurveda, we call it a dinacharya, right? Like how we start the day. So in the ancient Vedic times, there used to be like a whole dinacharya starting from 4 a.m. So I understand this. If we tell this to somebody like in Europe, he'll be like, wow, what a plan this is. So, but you can adapt it, right? It doesn't need to be 2 hours, but it could be just 30 minutes for yourself, right? And to start with a positive sattvic breakfast, that's really important. And this is one of my key health thing that nervous system is very important. So in the beginning of the day, you know that if your nerves are good, everything is good. So like I have been like a big fan of keeping your nerves sane, right? What goes inside and everything. But on a daily habit, if you, let's say you start your day with almonds, 8 soaked almonds, that makes an impact to your nervous system for the whole day. It keeps your protein level good. So that's a good thing in Ayurvedic psychology, that you, if you want to keep a good psychology, start with good habits. So my two giveaways for this is start the day with 8 almonds and finish the day off with golden milk. If you're a person who is advised not to have milk, you can use plant-based milk. But in the night, it's very simple. You can Google the recipe of golden milk, and you have plant milk, you have turmeric. And when you finish your day, just thank your nurse for coping up with the whole day. So just like this is like something we can do on a daily basis, like really changing and thanking our body for functioning good. Because all the time we are concentrated on that thyroid which doesn't work, but we forget that the heart is working and the lungs is working and the nerves is working, right? So we shift our perception to tap ourselves into this space where we really encourage our body and we connect with our body. So on daily basis also, meditation, connecting with yourself, 5 minutes just breathing. And like one of the things, because I work online too, is really after every 1 hour to have a glass of warm water and move your body a little bit, so your mind is not really full of thoughts and your body is not moving. So whenever you feel a lot of energy in your mind, start to move your body, right? And you can just start to feel calm down. And Ayurvedic psychology also advises do not take decisions from an agitated, angry, frustrated space. Take decisions from a place where you feel like, yeah, I feel this is right for my life, right? So these few things, like I could lecture on this for hours because that's my expertise. So these are some things, and this is the education part of the client where he can learn a regime or things he can do on a daily basis. And obviously awareness and acceptance about who you are. Like some of us are just entrepreneurs and as a woman, and that's who we are. But some of us are really, stay at home mom.
Mhm.
And there's nothing wrong in that, right? Like everybody is just different. So Ayurvedic psychology on a day-to-day basis, observe who you are and judge yourself less. Instead of
Yeah.
saying, what's wrong with me? Ask what's right with me. Right? So these some things are things what clients can learn about them. And obviously, when you go deeper, then comes the various types and understanding that and the various factors. But it is like it is so exciting. I mean, most of the clients who study with me and introduce Ayurvedic consultancy tell me the same thing. How did I live my life without this information before? This is the most common sentence I hear.
Yeah.
How? Wish I would have known it when I was 15, 16.
Yes. There's not much awareness, right? I
Right,
mean, that's the problem. Yes.
right, right. And you see, like when I talk about Vedic things and the great habits, obviously there's no doubt those are fascinating things. But as humans, we always tend to find the answer of the problem we are struggling with.
Mhm.
So we can just craft a message and tell it in that way, and he can start using Ayurvedic psychology without knowing that he's using Ayurveda. And a client who gets result, like me, and walks into Ayurveda never goes out again. So this is the way of how the modern Western world can really be influenced by Ayurvedic psychology and its work.
Well, I think it's fascinating work that you're doing, and we are bringing a program together with Dr. Sood on these different topic, and which we will tell everyone when we are ready to launch the program. In the meantime, if someone has any questions, I see quite a few people have been watching. If you can't think of any questions right now, you're welcome to put it in the comments, and we will get back to you. So,
Definitely.
yes. Any questions, comments, feedback from anyone who is live right now or later on, you are welcome to tell us how we are doing. We will continue to improve ourselves and bring you and empower you and educate you on how to take care of yourself, like Dr. Sood is talking about.
Right.
Anything else you'd like to say before we wrap up today? Fascinating, fascinating theory.
I'm really happy that you got this theory and we can influence the audience with making this world a better place. And really not, I would just say to anybody who is really not feeling good in this situation, or especially with COVID, it has been a challenging time for most of us. This is a time we really learn how to live in harmony with ourselves. It's a difficult time, but let's concentrate on what we have. Let's like spend this time to learn more about ourselves and how we can stay in a balanced state, because once you know that and once that smile comes on your lips, it won't go away. You'll just feel mentally so free. So everybody deserves this kind of freedom, and everybody deserves to live a life which is healthy. And if I can recover from difficult situation 2 times, a very sick childhood, hospitals every month, again sick, and so can you. So trust yourself. That would be my last message.
Thank you so much. And I know it's a very difficult time, especially in India, when so many people are losing their loved ones. And it's very, very, I think the mind is very disturbed. I mean, I'm here and I watch it and I get disturbed. So things like this, what you're talking about, is at least help all of us to maintain some kind of an equilibrium, right, in our mental state.
Yes. Keep your mind engaged, because, empty mind is then going everywhere. And, media is a little bit hyped, with every situation in the country. So don't lose your peace. Take care of your health, because that's the most precious thing you have.
Absolutely, absolutely. With that, thank you so much.
Thank you so much, Amita, for having me today. And I'm sure we're going to influence all our watchers and subscribers with Ayurveda and how to take care of their health in a better way.
Absolutely. We are coming up with the program with Dr. Sood. We will let you know. In the meantime, comments, feedback, welcome. We are an open book here. Thank you so much, and
Yeah.
bye-bye.
Thank you so much, Amrita.